Hello, this is Dr. Ajinkya here. Today I'm going to be teaching you the basic anatomy of Circle of Willis. So I'll be using a Stickman art theory to show you how you can easily draw and remember the exact structures in a case of Circle of Willis. So let's begin. So just imagine this is a Stickman figure theory. So you have a body like this. You have these two legs over here like this. So draw these two arms right over here like this. You draw a triangular head with a broad base, and remember here you gotta draw two shoulders, the above one being bigger one like this, and the lower one is supposed to be a shorter one like this over here. So what are these? These are the two legs, the body, the two hands below, the head, and consider this to be as a shoulder. So it's very easy to remember. Now, also imagine this head to be having a lateral horn over here. Just imagine the Stickman to have lateral two horns. Okay, and two horns above like this. So obviously the Stickman has to have eyes, so draw two eyes over here and draw a eyebrow like this, okay, and obviously you have to have a ear, so draw a ear like this. Okay, so very simple, right? But that's not yet complete. So the Stickman also has a shoe, so like this. You just have to draw a shoe-like thing on the lower aspect, and imagine the Stickman to be sitting on a Y-shaped chair. So between the two legs, you just draw a Y-shaped leg, and that's it. That's the Circle of Willis for you. Now I'll explain you in detail what are the structures exactly forming. So the two legs, as you can see over here, I'll just label them. So I'll use the other marker over here. So these two legs you can see over here, that is the vertebral artery. Okay, so these two are the vertebral arteries, and this branch over here, you can see the so-called shoe of the Stickman. This is the posterior inferior cerebellar artery. Okay, so in short you can call it as pica, P-I-C-A. Then this is a vertebral artery. Over here you can see is the arms, the two arms of the Stickman. They are nothing but the anterior inferior cerebellar artery. Okay, so in short we'll call it as ICA. Okay, so as we further move up, you can see this body over here. The body, that's nothing but the basilar artery. The main trunk, that's the main body, that's the basilar artery over there. And these two shoulders which we had mentioned before, so the below one is supposed to be the superior cerebellar artery, and the one above, which is a huge one, it's the posterior cerebral artery. Okay, so that's the basic concept of the body and the legs and the two arms and the two shoulders which we drew. And the stool which our Stickman is sitting on is nothing but the anterior spinal artery. Okay, And as we move on further up, this we could see here, that's the posterior cerebral artery. Now this two horns, okay, this is nothing but the middle cerebral artery. That's the middle cerebral artery. As we move further up, the two anterior horns which we drew, they are nothing but the continuation like this. They come like this, okay, so they are like this. These are nothing but the anterior cerebral artery. That's the anterior cerebral artery, as you can see over here. Okay, so now what we have here, we have the anterior cerebral artery, the middle cerebral artery, the posterior cerebral artery. So the three cerebral arteries, okay, these are the three cerebral arteries. And as we move down, we see the superior cerebellar artery, the anterior inferior cerebellar artery, that's the ICA. Then that's the posterior inferior cerebellar artery, which is the PICA. Okay, and in between we have this main trunk of the basilar artery, the vertebral artery, and the anterior spinal artery. So this is a basic structure of the Circle of Willis. You can remember in very short. You just have to imagine a stickman figure. You draw a head which is triangular like this, two eyes, two eyebrows, two lateral horns, two anterior horns, a body like this, two legs, two arms, well, at a below level, and two shoulders. Okay, just remember that he has two legs, two arms, and two shoulders. Okay, so two on either side to be precise. So now these are the basic structures. Now what are the eyes and the eyebrows and the ears stand for? Now as we could see, the outer portion over here, this portion was a portion of the middle cerebral artery, and this portion within inside the medial aspect, this portion over here is the portion of the internal carotid artery, the ICA. Okay, that's the internal carotid artery. That's the internal carotid artery, and this is nothing but the internal carotid artery, that is the eye, and the medial segment. So that stands for the internal carotid artery. Now as we know that the internal carotid artery gives off a terminal branch, and this terminal branch, what we see here is the eyebrow over here. You can see this eyebrow. You can see this eyebrow above the eye. So that is nothing but the ophthalmic artery. Okay, that's nothing but the ophthalmic artery. And the last thing which you can see over here, there is the ears. Okay, you can see this ear forming over here. That is nothing but the anterior choroidal artery. Okay, that's the anterior choroidal artery. So this sums up the basic Circle of Willis for you guys. So whenever you are confused or it's difficult for you to remember the basic structure of the Circle of Willis, just close your eyes and imagine a stickman figure with a triangular head, two eyes, two eyebrows, spiky, two horns, two lateral horns, then a body, two legs, one lateral shoe, that's the arms at a lower level, and two shoulders. So this marks the precise anatomy of the Circle of Willis. Now in addition, which you can see over here, this was the posterior cerebral artery. Now this posterior cerebral artery is connected to the middle cerebral artery through a structure you can see here. Now that is the cheek of the stickman theory. That's the cheek of the stickman. So this is nothing but the posterior communicating artery. So we will just mention it over here. That's the posterior communicating artery. we could call it as PCOM, PCOM. That's a short form for the posterior communicating artery. Now as we go up, you can see these two anterior cerebral arteries right here, and you can see a segment which is connecting between the two over here. You can see this. Now this segment is called as the anterior communicating artery. Now that's the anterior communicating artery. I will call this as the ACOM. Okay, now I will call this as the ACOM. So that is the complete figure of the Circle of Willis. Only one thing is left, that in the part of the body over here, now this is the area of the pons. So this is like the area of the midbrain, then this is the area of the pons over here, and this is the area of the medulla. So midbrain, pons, medulla. Okay, so we have 1, 2, 3, 4, 5. Okay, so 5 branches on each side. Now these are nothing but the multiple pontine branches. These branches, they enter into the pons, and these are called as the pontine branches. Now I'll be also teaching you the relationship of the cranial nerves in relation to the segments of the Circle of Willis. So this was the first part, just to remember the structure and the anatomy of the Circle of Willis. So in what easy way you can actually draw and remember each and every structure of the Circle of Willis in your, be it your exams, your theory, or your practicals, or whenever you're operating on a surgery at skull-based surgery, you can remember by using just a Stickman figure. So I think that is pretty easy to remember. So if you keep on practicing it, it becomes very easy for you guys. So this was just the first part. That's the anatomy of the Circle of Willis. Now the second part, I'll be teaching you the relationships of the structure of the Circle of Willis with the cranial nerves and the level of the skull base it lies in. So now basically, what is Circle of Willis? Now, Circle of Willis is nothing but a network of blood vessels, the network of channels which communicates the anterior blood-brain supply and the posterior blood-brain supply. So whenever there is any miscommunication or stenosis or obstruction or ischemia, anything leading to ischemia of the blood vessels in the anterior and the posterior blood supply of the brain, now these blood vessels in the Circle of Willis, they open up and they cause collateral circulation just to prevent the ischemia in the brain. So that's the main function of the Circle of Willis. So we have this basic, right, the anterior brain circulation and the posterior brain circulation. The anterior half of the brain is supplied by the bilateral here, the internal carotid arteries, and the posterior half of the brain, that's the posterior circulation, is done by the vertebral arteries. The two legs over here, those are the vertebral arteries. So that is by the vertebral artery. Now the vertebral artery, I'll just mention here, the vertebral artery being branches of the subclavian artery. Okay, so the vertebral artery being the branches of the subclavian artery. So on either side, I'll get back to this vertebral artery in detail about the subclavian artery and the retrograde flow of the blood into the vertebral artery following a stenosis of subclavian artery. So I'll get to that. So first, what we need to know is the basic anatomy of the Circle of Willis. Now, as we all know that the Circle of Willis has the anterior part, which consists of the ACA, that's the anterior cerebral artery, the MCA, which is the middle cerebral artery, and the PCA, which is the posterior cerebral artery. Now, it's considered that the middle cerebral artery over here, you can see here, that's the middle cerebral artery. It's not taken as a part of the Circle of Willis. So only the so whatever structures you've read so far, out of which the middle cerebral artery is not considered to be as a part of the Circle of Willis. So we'll start with the anterior cerebral artery. Now, the anterior cerebral artery basically supplies the frontal lobe. Okay, the anterior cerebral artery supplies the frontal lobe, the superior medial parietal lobe, 4/5 of the corpus callosum, anterior limb of the internal capsule, and the caudate nucleus. So these are the 5 structures which are supplied by the anterior cerebral artery. The anterior cerebral artery right here. Also, there are 5 parts. Okay, so there are 5 parts of the anterior cerebral artery. As you can see over here, that's the anterior cerebral artery. Now it consists of 5 parts. The very first part I'll just mention over here in this region. See, this is the ACA, that is the anterior cerebral artery, consists of 5 parts. Now what is the first part? What is the second part? Now the first part is also called as the A1. Now as you can see over here, the A1 is from the internal carotid artery. As you can see, this is the internal carotid artery within, and this is the anterior cerebral artery. By the way, there are multiple perforating branches over here, so you just have to mention that. So the A1, as I mentioned over here, the A1 is from the ICA up to the anterior communicating artery. Okay, so this is the anterior communicating artery right over here. So this part I'll just draw in red. So this part, what I'm drawing in red over here, right from the ICA, this is the MCA, this is the ICA. So from the ICA up to the anterior communicating artery, this part is called as the A1. Okay, so that's the first part of the A1. Now, the part of the anterior cerebral artery beyond the region of the anterior communicating beyond this part. So this part is considered to be as the A2. That's the second part. Now, what is the most important structure you have to remember in this A2 is that in this A2, it gives off a branch called as the distal medial striate artery. Now, what is this distal medial striate artery also called as? Now, it is famously called as the artery of Hübner. That is called as the recurrent artery of Hübner. Okay, always remember that. It's a very important MCQ question for the PG students who appears for the NEET exams. So it's a very important MCQ. That is the recurrent artery of the Hübner is a branch of the A2, that is the anterior cerebral artery, second part. Okay, now that was A1, that was A2. Now A3 is nothing but it is around the callosum, so it is a terminal branch. It is also called as a pericallosal part. So it is called as the pericallosal. Now, as I mentioned before, that the anterior cerebral artery supplies 5 structures. Those structures, out of one was the corpus callosum, right? So it has a branch called as the A3, which runs around the callosum. So it's also called as the pericallosal branch, which is actually the terminal branch of the ACA. Okay, so following which the A4 and the A5, the 4th and the 5th part, they are called as supracallosal. Okay, so these are called as supracallosal branches. So in total we have 5 branches or 5 parts of the anterior cerebral artery. Now moving on, as we mentioned before, the middle cerebral artery is not considered to be as a part of the Circle of Willis, so we will skip it. The third part, which is the posterior cerebral artery, right over here, the posterior cerebral artery. This is a posterior cerebral artery, the upper shoulder basically connected to the internal carotid artery with the means of posterior communicating artery. Now, the most important thing you have to remember here is that the posterior cerebral artery is a branch of the basilar artery right over here. Okay, so always remember that. Many people get confused that the posterior cerebral artery is a branch or the continuation of the internal carotid artery. No, it's not wrong. It's not right. This you can see over here is the internal carotid artery, and there is no way connection to the posterior communicating the posterior cerebral artery. It is just connected by means of the posterior communicating artery, but it does not arise from that. So the posterior cerebral artery is obviously a branch of the basilar artery right here. The body is the basilar artery, so that's the basilar artery. So it's a branch of the basilar artery, and as we know that if it is in close proximity to the oculomotor nerve. Now I'll be in the next segment dealing with the relationship of the circle of Willis with the cranial nerves. So just for now, remember that this is the area of the pons, and this is the area of the third oculomotor nerve, like this right here above near the superior cerebellar artery region. So that's the area of the third cranial nerve. So if something has to happen to the posterior cerebral artery, like here, it affects the third cranial nerve. That's the oculomotor nerve. So it affects the oculomotor nerve, and it may affect on the same side and cause Horner's syndrome. It causes Horner's syndrome. It causes Weber's syndrome. Now, what is Weber's syndrome? Weber's syndrome is nothing but the third nerve palsy with contralateral hemiplegia. So that's the Weber's. So these are the, so if in case the posterior cerebral artery gets damaged or undergoes some kind of ischemia, it could lead to Horner's syndrome. It could lead to Weber's syndrome. Okay, so that was all about the posterior cerebral artery. Now, as we move down, what we see is the area of the superior cerebellar artery. This is the area of the superior cerebellar artery, and below which this is a main trunk. That's the basilar artery. As you can see, this is a basilar artery over here. Now, the basilar artery is the artery which arises by the junction or the union of the two vertebral arteries on either side. So this is a basilar artery. It is formed by the union of the two vertebral arteries. The vertebral arteries, in short, being the branches of the subclavian artery. So now the basilar artery mainly runs in the area of the pons. Now this is the area of the pons over here. So it supplies the pons, it supplies the cerebellum. Now, if in case the basilar artery gets occluded or undergoes some kind of ischemia, it leads to definitely a stroke, and it may lead to a condition known as a locked-in syndrome. So the basilar artery stroke can lead to a condition called as the locked-in syndrome. So this is the clinical significance of the basilar artery stenosis or ischemia. Now, the basilar artery further below gives a branch. That's the anterior inferior cerebellar artery. That is the ICA, which was the lower arms of the Stickman. And there we come, the two legs. That's the vertebral artery, and this is a lateral shoe giving off by the Stickman, and that is the posterior inferior cerebellar artery. And considering the Stickman is standing over a Y-shaped stool, so that's the anterior spinal artery in that region. Now, there's also one more important MCQ for the exams where people get confused that where does the labyrinthine artery come from? Now, the labyrinthine artery, also called as the acoustic artery, the labyrinthine artery. Now, so if you just pay your attention on this side, now I'll just mention the labyrinthine artery in around 85% cases, okay, in 85% cases arise from the ICA. Now, what was ICA? Which is the anterior inferior cerebellar artery right here. That's the ICA. So this was the anterior inferior cerebellar artery. Now, this could be the region where the labyrinthine artery arises from. So it arises in 85% of cases from the anterior inferior cerebellar artery, and somewhat 15% cases it arises directly from the basilar artery. Okay, so it could just directly arise from here. That's the basilar artery. So this is the option 1, this is the option 2. So the most common being the option 2, that is the 85%, that it arises from the anterior inferior cerebellar artery. Okay, so that's the labyrinthine artery for you guys. So that sums up the entire anatomy of the Circle of Willis. Now, what in the next segment I'm going to be teaching you is the relationship of the Circle of Willis with the cranial nerves. So what we're going to do over here is like we're just going to compare this left side and the right side. So on the left side you have the entire Circle of Willis with proper labeling, and on the right side I'm going to be showing you the exact the levels of the skull base in relation to the Circle of Willis. So you just have to draw, just imagine this. This is the so this is the posterior clinoid process. This is considered to be as the posterior clinoid process. Now we know that there is one anterior clinoid process and the posterior clinoid process, which being both the parts of the sphenoid bone. So this is the posterior clinoid process. I'll just mention it. Posterior clinoid process. Okay, so now from the posterior clinoid process, you draw a horizontal line, so passing through the level of the posterior clinoid process, and you go below, you pass one more line through the passage of the abducens nerve. That is the 6th cranial nerve. That's the abducens nerve. Now that is from the junction where it arises from. That's the area of the pons it comes from. So that's the abducens nerves. You further go below, and you draw a horizontal line through the opening of the hypoglossal canal. Now that is the 12th cranial nerve, and that is nothing but the hypoglossal canal. That's the hypoglossal canal, and further below you draw a line horizontal denoting the cervical vertebra C1, cranial 1. So that's the first cervical vertebra. So this is how you divide the skull base into 4 regions. Now this is classified to be as the cranial one, this is classified as the middle one, and this is classified as the caudal one. Okay, so these 3 are the regions where the Circle of Willis is gonna lie, and around which the olfactory, the cranial nerves are gonna pass around. So I'm gonna show you in a diagrammatic presentation where exactly the cranial nerves lie around. So I'm gonna show you the exact depiction. As you can see over here, this is the area of the first, as I was showing you, the most this is the cranial part. You can see this is a cranial part. So this is a cranial part over here. That's the first part, and as you can see, this is the superior cerebellar artery. The superior cerebellar artery, that is the SCA, and just below it is the 3rd cranial nerve. That's the 3rd cranial nerve running obliquely just beneath the superior cerebellar artery. So that's the first. So basically what we have in the first segment is the 3rd cranial nerve. Okay, that's first third cranial nerve. And if we give a close look around there, if we give a close look, so you can see that's the first segment, and that's the third cranial nerve. Lateral to it, this is a fourth cranial nerve, this is a fifth cranial nerve, and what you see here is the pons, and this is the basilar artery, that's the superior cerebellar artery, and that's the third, fourth, and fifth cranial nerve for you guys. Okay, so that these cranial nerves are seen in the first segment as I showed it to you. So third, fourth, and fifth. So 3 cranial nerves come in the first cavity. Now as we go below, we come in the middle segment, and in the middle segment you can see, now that's the middle segment as you can see here. That's the middle segment, and what you see in the middle segment is over here. See, this was the 6th cranial nerve, and as I mentioned before, the middle part starts at the junction of the 6th cranial nerve. So that's the 6th cranial nerve. So what you can see over here, that's the 6th cranial nerve. So this area is supposed to be the middle cranial cavity. So this is the 6th cranial nerve. That's the anterior inferior cerebellar artery, the lower arm of the Stickman. So above the aorta, that is above the anterior inferior cerebellar artery, is the 7th cranial nerve, and below is the 8th cranial nerve. So always remember that the anterior inferior cerebellar artery divides the 7th cranial nerve and the 8th cranial nerve, and below which is the 9th and the 10th cranial nerve. So between the AICA and the PICA over here, we can find 3 nerves running laterally, which is the 8th, the 9th, and the 10th. So then comes the PICA. This is, you can see the 2 vertebral arteries over here. These are the 2 vertebral arteries. That's the basilar artery, and this is the lower part of the pons, you can see, below which is the medulla part. So as you can see, the blue line denotes the middle part, and moving on to the lowermost part, you can see here, as you can see, this is a vertebral artery of the left side, and this is a PICA, and that's the 12th cranial nerve with 2 segments, and behind the 12th cranial nerve you can see the 11th cranial nerve, that's the spinal accessory, running obliquely posterior to the 12th cranial nerve. So this is how you, if suppose a skull-based surgeon, when operating on a Circle of Willis, a case of midbrain skull-base midbrain pons medulla. So whenever he comes across such vascular Circle of Willis, it is very important to know the anatomy and the relationship of the cranial nerves as well. So basically it's very easy for you guys now after clearing up the basics, and always remember the so-called famous Stickman figure for your Circle of Willis. So basically we have covered the structural anatomy of the Circle of Willis, the relationship of the Circle of Willis with the cranial nerves, and the clinical significance of each and every artery. It's very important to understand. So I hope this is a basic of Circle of Willis which I have covered up. So keep subscribing. I'll be teaching in detail about the surgeries of FES, the skull base surgeries, and in detail I'll be teaching in between the various anatomy of the common carotid, the external carotid, the internal carotid, and the infamous internal maxillary, and the 3 parts of it, the spinopalatine, etc. So I'll be dealing with all the vascular anatomy in future videos. So thumbs up, keep liking and keep subscribing for the videos. Take care.